I'm almost at my destination, so this video is going to be quick. I hope you enjoyed these short videos as I ride in for my 50-minute miles to my site. Just some housekeeping tips when you go on your site. Always have a set of gloves and a mask, especially dealing with the indication. If you're kind of feeling under the weather and you know you're dealing with a study that has participants who have compromised immune system, wear a mask in support of trying to minimize transmission. Reschedule if you can. Another thing, I encourage you to have a set of gloves, because sometimes when you looking at your IP kits, you know, especially if it was a situation where the person was administered the IP kit, the IP sub-Q or IM, sometimes blood be on the administer's gloves, and then when they pick up the kit, they transmit that blood to that kit. So you wanna have gloves, you know, just in case you need to when you're dealing with IP kits. Have you some Clorox wipes, because you know we travel and we go into the restrooms that might, you know, not be up to par. So you want to make sure that you have some disinfectant once you leave your site. You know, you want to take one of your little Clorox wipes, wipe the table down, the chair down, you know, for the next monitor to come in for a clean and safe environment. Now, that's not mandatory, but you know, if you've been eating Cheetos, you spill some drink on their desk, you know, clean your mess up. That's pretty much what I'm saying. If you're gonna be gone for a long period of time, consider having a backup charger. I have been on site where I didn't have the charger that came with the laptop, but I had a backup charger, and I picked up my backup charger rather than the one that came with the laptop, and it died. And just so happened the site that I was in, that's all they used the same brand laptop, so they was able to give me let me borrow a charger while I was on site. So now I keep one in my suitcase and I keep one in my boot bag. What else is a good thing to keep in mind when you're traveling for your sites? Try to have your computer already charged, because you never know what you might face when you coming on site. So, you know, while you're in your hotel room or your house the night before, already have your computer fully charged. That would be one suggestion that I would say. And I guess I would always try to make sure you come in with a good attitude. You got to understand that you might not see the doctor during that visit. You might not or see the PI when you want to. Sometimes, you know, ideally you want to see the PI at the end of your study visit versus in the beginning, because it's really nothing to discuss if you know you haven't reviewed anything. So how you handle that situation, let them know what your plans are. Should you find any issues, you'll follow up with the phone call or an email, and that just allows you to cover your bases. So have your supplies, have your PE equipment if you need it, and have a good attitude, and understand that you might have to be flexible. And don't be afraid to have the hard conversations. We know we have sites that are very nice, but they might be, you know, slow to respond to your request. So don't be belligerent, don't be rude, understand what's going on, and try to compromise. If there's 5 tasks for them to do, say, hey, by this day I need these 2 tasks done, by this day I need these 2 tasks done, and then by this day I need the final task done. That way they might not seem so overwhelmed. You get what you need, they get what they need. So learn how to read the room, know your site, and know how to respond. And this is the final video because I have reached my destination.